Hi, everyone, and welcome back to another episode of Public Health Career Conversations. I am very pleased to have with me today Mrs. Adel Badenhorst, who is the Project Officer in Communications at Panagora Group in South Africa. Adel, thank you so much for joining us today and giving of your time.
Thank you, Atia. I really appreciate this opportunity.
So, as I've said before, we are endeavoring to describe the myriad of career paths to and within public health. And you have quite an interesting background. I'm not going to spoil too much of it for people who are watching, but you, like many of us, started in more of the clinical services and now are working like me behind a computer. So
Yes.
So maybe just take us through that. Can we start like way back when you started your undergraduate studies and journey us as to how your career has evolved?
Okay. Thank you, Atia. So yeah, I initially entered university to study chemical engineering of all things. So that's not even clinical or public health or anything. But the first day that I arrived at the university and I saw all the other engineers on campus, I realized this is not for me. I am not going to thrive in this environment. So I studied at the Northwest University, and I always had a very big interest in biology subjects at school, the way the body works, physiology, all of that. So I knew I wanted to go into some sort of medical direction. I was tied to studying at the Northwest University, so I had to sort of choose like what options are there. Pharmacist, no, I think pharmacists are very smart, very clinical, and I didn't think that also really fitted my needs. As a young person, you're still trying to find your feet in that. So they also had nursing. I also realized nursing was not going to be for me. So I discovered dietetics. So I applied for dietetics. Actually, before I applied for that, I started studying biochemistry and physiology to sort of tap into what I knew was my interest. So then I thought, okay, let me try and be a little bit more focused, moved into dietetics. So did that for 4 years until I graduated. Then I did my Zuma year or community service year as a clinical dietitian in Ventersdorp in Northwest. So I worked there at the hospital and at the clinics, and I was very, very fortunate in that Ventersdorp was quite a small community. It had a small hospital, but their primary health care was very strong in that district. Dr. Kenneth Kaunda in the Northwest. So my work started off in the hospital, working with your severely malnourished children that were admitted, but it really branched out into the community, working in the clinics, going to the different clinics at different spots where we have all the clinics. I think we had 11 clinics in total. So work there focused a lot on breastfeeding management, infant feeding, all of that. And while I was doing that work, I realized that communicating health messages is so important and very underappreciated. And I really taught myself like how to develop flyers, how to make it pretty and all of that without even realizing that communications in a public health setting is even a career option. I thought it was only like your straightforward like dietitian, pharmacist, nurse, doctor, like that's what you do. Then continue doing that, focusing on breastfeeding management, training, did a lot of training for the nurses on breastfeeding management in back in the days. I think we still have it though, but we did that mother baby friendly hospital initiative. So we did that. It was a WHO initiative that we implemented, really focusing on the mom and the baby directly after birth and all of that. So did a lot of training. So with doing that, I also realized that training was a very big passion of mine. And I have to say, at this stage, it really moved away from liking, although I like working with people directly, but I realized that doing training and developing like those messages, pulling like together all the different things, how HIV comes in, how TB comes in, like really that public health sort of thing. It's not just one subject on its own, it's this whole broad, comprehensive concept. public health, and realizing that I think that is where I really want to go to. And then I had the opportunity to attend a breastfeeding management training in Mafeking with FHI 360, and that's where I met one of my colleagues that I'm still working with today, Surina. Um, so I was, of course, very active in the course, being the little head girl in front, like, oh, I know the answer, I know the answer. So she approached me afterwards and said, like, they have this position available at an NGO. I said, what in the world is an NGO? What is this? A whole new world that I knew nothing about. So applied, got that position, moved to Pretoria and started working in that. And I think when I moved to FHI, that's where really the concept of public health and the potential in that career or in that, that path for you has, and really that knowledge setting in of public health, nutrition, all of those things are so related. HIV is not just one thing, it has so many. If we're talking about HIV specifically, I know public health is way much broader than that. But that really opened my eyes to the policies that's available, how all of those things integrate. From there, from FHI, I moved into communications a little bit more, tapping into those skills that I developed while I was working at Ventersdorp as a dietitian. Started going into reviewing documents. What's the messages that we put out to the public? So that's really where the communication work started. And then I was lucky enough for that to develop and evolve over the years, so that now, what's it now, 10, 12 years later, oh my word, I'm working at Panagora as a communications officer, but I still have my very deep roots in health, nutrition, the clinical type things that I learned back then. That's always like the background and my sort of basis for everything that I'm doing today.
Great. Thank you. So that's a really interesting lens. And the reason why I'm saying this is because I think, part of the impetus for the series was because there's a lot of younger colleagues who are interested in public health as a
Yes.
career. But of course, public health being sort of relatively sort of not, I won't say underfunded, but there's not as many posts to study formally, whether it's an MPH or specialization. And so, people can get disheartened. They like, oh, well, I tried to study formally in this. So what I really like about what you're saying is that you actually utilized on-job training to, and so on-job training and sort of your own after hours, your own training, learning how to develop your own posters and the like to craft your niche based on your interests. So I really like that lens, so that people can understand that yes, formal training in certain things does give you a certain knowledge and skills, but while you are waiting for that, you can you can still get skills elsewhere. And I mean, nowadays there's plenty available on the internet that you can go read and engage with and teach yourself as well. So that was really, I think it was a really great learning there. Maybe just, you just said in your last words is that you do use your what you learned in undergrad, and you pull that, you still pull that through. And I think maybe can you reflect a bit more on how does that play out for you? Because I think a lot of people think that if you studied for 4 years and then you go on a path that's slightly different, that is quote unquote maybe wasted. So maybe if you can just unpack that a little bit for us.
Yeah, well, definitely not wasted. Even though I don't utilize the nutrition background anymore at all, like I said, that was still the basis for me to get where I am today, and I fall back on that knowledge so often. Working with my other colleagues at DIU included, like if there's ever a discussion around clinical things, hospital related, HIV management, broad health things, I know what you guys are talking about, and that has greatly assisted me in contributing to the discussion, contributing to technical documents, helping out in policy review, for example. So I might not use those skills every day anymore, but it's definitely the foundation that has helped me to get where I am today.
Mhm.
Yeah.
That's you know, I just prior to this interview, I actually had an interview with another colleague, and he was reflecting on the fact that so he came from another country, and he said he did online courses and how those online courses helped him to speak the language
Yeah, yeah.
of public health. And I think that is similar to what you are reflecting on here, is that having that background in health did help you to, or now, as you say, when you're going through technical documents, you are familiar with the
The dog.
language,
Yeah.
with the principles underlying things, because it is also a sort of science that we, not a sort of science, it is a science that we are
Yeah.
dealing with. And so you have to be familiar with the language around it in order to communicate that effectively going
Yeah,
forward.
definitely. And the really cool thing about public health is that it is so broad. You can you did mention
Mhm.
like you can go in, like into formal studies and you can do that definitely. But it there's so many different ways to get to public health. It's not like clear, like you have to take this study or this route or whatever. It can be a little bit of a this to get to
Mhm.
public health at the end of the day. If you have that one opportunity that gets your little foot into the door of exploring opportunities like that, I
Mhm.
think that's what I really appreciate in general about public health. That it's yeah, that it's I don't want to not easy to get into, but yeah, it's broad. It's quite broad.
Yeah, yeah. And you can sort of merge your interest in a way. So another discussion I was having with someone who is also came from a communications background. So
Mm.
a crossover from you. This colleague came from a communications background into health,
Yeah.
um, and uh, and the reflection from her was around the fact that there's many parts of public health that have um, you know not, I'm not going to say non-health, but they are subfields within health. So for example, human resources,
Mm-hmm.
financing, etc. And so you can come from those backgrounds and also merge those or overlay health,
Yeah. And I mean,
health.
accounting as well is a very good example.
Mm,
How you can use your accounting skills to get involved in the public health sector, but
yes.
health financing and all of that.
Yeah. So, on that note, what many people don't know is exactly what it is that we do on a day-to-day basis. So, for anyone
Do
who's
we
watching,
know?
we sit and type on computers.
Correct.
um, but yeah, for anyone who's watching and thinking, "Oh, project officer communication sounds fun and interesting," what exactly is it? What is it that you, without, I mean, I know you can't spill the entirety of your projects, but what is the type of work that you do and are involved in?
So, as Panagora, we support USAID, or the United States Agency for International Development, to implement their work. So, a lot of the work that we do is in support of that. And USAID has different programming. One program area, for example, focuses specifically on orphans and vulnerable children and youth, and prevention, HIV prevention projects and initiatives focused at that orphans, vulnerable children, and youth. So a lot of the work that we do is related to that, like how do we communicate those messages? How do we package those messages so that it's accessible by the youth? And that's where that clinical background really plays a role.
Mhm.
If we're talking about sexual reproductive health, for example, that's clinical background. But now, how do we communicate that? That's the communications. That's the communications part. Another big project that we're supporting USAID on is the Dreams, or Determined, Resilient, Empowered, AIDS-free, mentored, and safe. And that project targets adolescent girls and young women aged 10 to 24. And that's also really around HIV prevention, taking PrEP, your pre-exposure prophylaxis. How do we communicate that? What's the benefits? What's the potential side effects of that? And how do you package that so that these very, very vulnerable adolescent girls and young women will access that to enable them or for them to be as a HIV prevention method. So it's really taking that clinical knowledge and then applying it so that the general public, I can probably say, can access that information, use it, utilize it, take it in, and actually, improve their lives at the end of the day. So if we're doing social behavior change communication with them, it has to be done in such a way that they actually implement and do it. And at the end of the day, stay HIV free. If they're HIV positive, staying healthy, taking their medication on a daily basis. So that's a really good link between those two. And that's in a very broad sense what we do.
The other aspect that that I found very valuable. So as viewers may have realized, Adele and I do work together, and the one thing that I did find very valuable is the inputs that we get on our technical documents. So aside from messaging outside to the public, there's also messaging to external stakeholders. So for example, if we did a project for a certain stakeholder, or if there's some reports that need to go to USAID, for example, and having someone check that for consistency of language and ensuring the messages are right, and that is a very valuable input that we get, that somebody is kind of just making sure that everything is sound and consistent with what we are trying to say. So I think that's another aspect of the work that
yeah, definitely. And having that bit of clinical health background is a reason why TI, for example, got assigned to you to work on your project with you. Because you have that bit of background. It's not as extensive as your own knowledge, of course, but at least you have that little bit of context to what is being communicated on this document that we're working on. And how can we, although your things are always perfect in any way, but how can you slightly communicate that, a little bit better, editing and formatting. So you're right, that is a very big part of what I do as well. And that health background has greatly benefited that part of my work as well.
And and I said, I mean, thank you for saying that my work is up to scratch. But sometimes, even as a technical person, how you are communicating something is not necessarily how someone is reading it. And so that's a very, valuable input. Somebody's like, this, what exactly are you trying to say? Because it's confusing. So I think that having that that lens and it just speaks to the fact that like you do need a multidisciplinary team.
For sure. Yeah.
Trying to make sure that you have all the way through from conceptualizing the project all the way through to the final report. We deal with multidisciplinary teams. Is project managers, and there's the technical consultants, and then there's the communications consultants. Everyone is busy having a look at this package so that it is robust, and hopefully nothing goes amiss, because there's so many eyes on a project. So
no, definitely that multidisciplinary team is a very great asset as well.
So my last question to you.
My last answer to you.
Yeah, so it's basically really around somebody who is wanting to enter the field or contemplating entering the field. Maybe there's somebody who's studied dietetics and is thinking, oh, that's an interesting option that I never thought of. If you were to think back, to when you were just starting out and sort of trying to figure out your niche, and somebody had to advise you, what type of advice would you have liked? What would you have thought would be useful that you actually want to now hand over to a generation of practitioners?
So this question is such a good question, because I want to teach that to the two girls as well, that a career path isn't just one thing. It's not one thing that you study It's not one certificate. It's so much broader than that. There's so many opportunities out there available. I mean, just take me, for example, entered as a nutrition person on a project 10 years ago, and now I'm in communications in sort of the public health field. So that just like took away like a long road. And I loved that journey. It was absolutely amazing. So I think the main advice that I would say is it doesn't have to be a straight path. It doesn't have to be one certificate or one, degree that you have to do to eventually get into public health. If you're uncertain now of how to get into public health, maybe do something that you're interested in now and see what opportunities that could open for you. Look at
Mhm.
job opportunities in NGOs, organizations. Start off as, even if you start off as a project assistant or as a just an administrative individual in an organization, that's also great, because that's also how you open doors. If you have the
Mhm.
right attitude, you're always willing to help, you're willing to empower yourself, always learn more. If it's necessary, get those extra certificates or degrees to help you advance your career even further. But don't don't look against the wall and say, this isn't, I can't get past this wall. There's many ways to get around that wall. Just
Mhm.
be creative and be open to new opportunities, and yeah, just the exciting things that are available out there for us.
Mhm. I love that, Adele, and I'll tell you why. It's because many of us get into university degrees, and this is now reflecting back to your experience in
Yeah.
university, not knowing what the implications are, not really knowing what it is that we're studying, and come out of it and go, okay, now what next? And the only path you may see is that linear path, whether it's, oh, I'm a doctor, and so I work in a hospital. And so it's really great advice to the younger generations to think about, okay, so I've got this skill set and I've learned this set of knowledge in my undergrad.
Mhm.
I'm interested in this, like the way you realized that you were interested in messaging, and then think about how that may articulate, because it's not a waste to have studied, nor is
Mm-mm.
it a problem to take your career in another direction, if you so feel fit. Like
Yeah.
there's nobody that has says that since you studied this, you have to do this.
No,
There's
no.
so yeah, so I really like that advice, because I think people feel like, oh, I studied for so many years and now I'm throwing away my degree. You utilize
Yeah.
those skills in other ways. A lot of the point of tertiary education, especially, is that you learn other skills. You learn to work
Mhm.
independently. You learn to do research. You learn,
Yes.
it's not just about the knowledge that you get. So you
Yeah.
can have those skills, and as you say, if you can take that and then go into the working world and put yourself out there and be proactive, that will serve you more than sort of the knowledge alone that you may have
Yeah.
learned about nutrition, for example.
Yeah. I have to say, one thing that I do wish I did was some
Mhm.
sort of certificate or diploma in monitoring and evaluation, type things, because that is such a broad and useful skill to
Mhm.
have. And even though I have the practical skills for that, but I just see like M&E people, especially in our world, that they are just how much they thrive and how diverse those skills can be applied to. I mean,
Mhm.
in our own example, some of our team members started off with monitoring and evaluation, and now they are leading
Yeah.
projects, leading teams that's related to health, public health things, but they started off with those M&E skills. So I think that's also, I think, a good piece of advice. Like if you're not 100% sure right now how to get into
Mhm.
public health, maybe start off with an M&E type certificate, data management, data analysis, and see where that takes you, because it's a skill that can be used across all
Yeah.
the different fields within, yeah, public health, and a
And
very
even
valuable skill to have.
even outside of public health, more
Yeah,
data,
yeah,
and
yeah, yeah,
data is the way the world is going.
yeah.
But I have to say, Adele, with your 5 minutes over that you have at the end of the day, with your busy schedule, I'm sure you can do a monitoring and evaluation course somewhere.
Yeah, I'd love to. I'd
Please
love
let
to.
me. So it's not too late. You can
No,
you can
no, it's not. That is very true.
Yeah.
That is very true.
I will keep that in my diary and be like, ask you about it to say, have you done your monitoring and evaluation?
Okay. Ask me in 5 years. No, I'm joking.
Okay.
Ask me next year this time. It'll be done and in my pocket.
Okay. This is going to be on YouTube, so the YouTube people will even come and ask you.
Okay.
Thank you so much. So that was my questions. I don't know, besides the last plug for monitoring and evaluation, anything else you have that you want to leave us with?
Yeah, I think for me the main thing is don't keep your eyes on that linear path, Atia, that you spoke about. Like, be open for different routes and turns that could lead you to public health at the end of the day. Just be open to those experiences, and it's not a straight road. It might be a little bit curved, but it's fun all the way around.
Thank you, Adele. This was really, really fun and interesting. And I wish you all the best in the next projects that we are going to be doing together.
Thank you. I can't wait.
And have a lovely rest of your day. Thank
You
you.
too, Atia. Thank you.